Hi, everybody. It's me. It's Dr. Kestler from Lorain County Community College with a co-video. Today is the 18th of November, and we are in the middle of the third surge, and this is a huge surge indeed. And I want to present today that we're very seriously facing a crisis right now. But I also want to point out that there is a lot of hope out there. There's a lot of good things that are coming, and so I want to leave you with that. My temperature is 36.5 or 97.7 degrees Fahrenheit, and I'm feeling pretty well as a result of that. And you can see where I am. I'm actually at Lorain County Community College, and in this cell culture room. And you'll see why I'm in the cell culture room, because I'm going to talk a little bit about that later. First of all, as I think everybody knows, Ohio is having a huge surge, as is the whole country and is the whole world right now, having a huge surge of cases. I have been following the governor's watch list here, and this is the number of colonies that are the number of colonies. I keep saying that wrong. The number of counties who are on alert, and we're up to 58 now as of November 12th. Today or tomorrow there will be new updates coming with respect to that, and we will see where we're going. Hopefully we'll go back a little bit, but nonetheless, we are about a week away from Thanksgiving, and we need to take precautions. Sometimes that means changing plans, and we have changed our plans in my family, and I know it's sad, but at the same time, it's a sacrifice that is worthwhile to protect people right now. And there is an end in sight, I promise you. That's going to be the big message at the end. And so if you're looking for what I like to call the light at the end of the tunnel, if you're looking for that ray of hope, it's coming. It's coming. It's going to be towards the end of the talk today. First of all, you can see what we're dealing with here. We have a case count in Ohio that is going up. We have hospitalization that is an all-time high. As a consequence of the hospitalization, we have stress on the healthcare system. When the healthcare system is stressed, it does not deliver as well as it should, and there's problems. So part of what we are doing, this whole business of, and I'm going to go back to something that I talked about a very, very long time ago, and that is flattening the curve. Flattening the curve is something that is important. Does it result in less cases? Not necessarily. Here is the world, the heat map of the world right now, and you can see most of it is red. This heat map, this is data that comes from Hopkins that is published in the New York Times. They're changing the code here. Probably tomorrow it'll be changed, whereas they've actually developed deeper colors to represent where cases are worse. So you're going to see a little bit of a different, next time I'm on, you're going to see a little bit different pattern. And we've gone to some really darker colors to account for the fact that right now we're in a very serious kind of situation, and red is not red enough. So there's more of a deeper, darker color coming soon. So you can see that most of the world is got lots and lots and lots of infections going on. And it appears that this third peak for the world might be soon peaking. I don't know if that is the case there, but you can see that curve up at the top. Deaths have been pretty constant all over the world for a long, long period of time, and they're at an all-time high right now. So that's what the world is right now dealing with. In the United States, we don't see that peaking yet. I'll tell you that right now. We look like we're going, this curve appears that the cases that we have are going straight up to the sky. So, we are in the middle of what would be the worst crisis. If I had to talk about this in terms of a holiday, I would say probably a big contributor to this surge in the United States is Halloween. I think there were a lot of parties, people, maybe private parties, maybe not at bars, but people like to celebrate, and that might be where some of this new cases are coming from. Again, Thanksgiving's next week. I just want to point that out to everybody, that Thanksgiving is next week, and so that becomes an interesting situation. Here is the United States. We see a lot of red here, and it's been going on quite some time. And so you can see the United States map, the heat map here is, the Midwest is quite hot right now. I think I can see some trends going on in Wisconsin. I have been worried about Wisconsin for a very, very long time, and I see that going down. I think Illinois might also be getting better as time goes on. I know it doesn't look that way, but there still are some very red spots on here that we need to worry about in the future. Like I say, I have heard stories all over the country of nursing staff, medical staff in short supply all over the place. They have enough illness. They have a lot of things, and we are missing people. We're missing staff in the hospitals, which is a huge problem. I have heard of people who have COVID being called into work. Can you please come in, even though you have COVID? So that's how serious it is in places, in hospitals all over the country. So it is something that we need to, take a lot of extra precautions against. We don't want to end up in hospital beds in like gymnasiums. Here is two scenes. One is from pick which one you want to look at. One is from Italy back in March, and one scene is from 102 years ago. And I'll let you do the calculation and the math about what year that was. It was 1918. In 1918, there was this kind of situation. That was a flu, and this is a coronavirus. I want to talk about a couple of good things with respect to pharmaceuticals, and that includes the monoclonal antibodies. The president received them, and that's how he recovered. Monoclonal antibodies are a temporary solution. They can help you through a bad situation, but they do not provide you lasting. They do not provide you with lasting immunity. You have to get that from either getting the disease itself or from a vaccine. And hold on, I do intend to talk about vaccines. So the way that these things are made is you basically take a mouse and you inoculate it with whatever you want to have it make a response to, and then you take the spleen cells out, and then you look for the cell that is producing the antibody that you're interested in. And then you take that cell and fuse it with a myeloma cell, and then you grow those cells. You screen them to see which one is which. You grow those cells in culture, and that's how you get that. And then those can be used to deliver. This is somewhat of a better way than convalescent antibodies, simply because I know we like to use these because we can control the amount. We know exactly how much we're putting in when we do the monoclonal antibodies. In the convalescent therapy we've not been able to find a good number of people with high enough titers to produce that type of thing, but this is a replacement of. I want to talk for the rest about vaccines. And we have some fabulous vaccine news this week. We heard last week from Moderna, this week from Pfizer. Moderna will be wrapping up their study within probably a week. I hear rumors that there's good news coming also from England with a whole different style of vaccine. But I want to talk about the Moderna and Pfizer vaccine, because those are the ones that I think are very promising. And I think the great thing about them is they have the safety that would even make a anti-vaxxer turn into a vaxxer. They have incredible safety built into their whole design. So let me just do a little bit of a history of vaccines in general. Vaccines have been going on for decades. Before Edward Jenner discovered the first vaccine, they were using in China a technique called variolation, in which they would give you a teeny bit of the agent, which is the infectious agent, and then you develop an immune response against a teeny bit. There is some evidence that, by the way, masks can produce, so if you were to get COVID right now, let's say I had COVID, and you got it from me through my mask, which is a distinct possibility, the fact that I'm wearing a mask and not giving you a full-blown dose, you get a smaller dose, we think that might represent variolation. And we did see something like this in the hospitals in New York when they started putting cloth masks on everybody who was not in the COVID units. Obviously, in the COVID units, they used the N95 masks and other PPE. And in other parts of the hospital, when they started using this, they noticed that some people were getting infected, but they were getting milder cases. And that might be because of the dose that they got. And so this little girl in this picture is actually getting a dose of smallpox, which is the original disease that vaccines were developed against. Of course, there's the attenuated vaccine that came from Edward Jenner. He discovered, you'll notice in the background of this picture, there is a cow. Cow is a very big part of the attenuated vaccines. And so he was able to take cowpox and vaccinate people, including me. I'm old enough to have gotten a cowpox vaccine and protect people. Younger people don't get this vaccine because this is what I consider the greatest accomplishment of public health is the eradication of smallpox. We were able to get rid of smallpox through vaccination efforts. Then we came up with the cell culture technique. Cell culture technique was based on the work of actually somebody who was local, a guy by the name of Fred Robbins. Fred Robbins, who was a professor at Case Western Reserve. By the way, one of the last things he did before he passed away was contribute a paper, actually my paper, about HIV vaccines to the proceedings of the National Academy of Sciences. And so I'm very proud to have actually known him. But he, along with Enders and Weller, came up with a way of growing polio in culture. And so we have the first of the cell culture vaccines where we can start mass producing vaccines that way. And cell culture, of course, led in other areas too. The papilloma virus vaccine, Gardasil, came from the work of a guy by the name of George Gee, with a great deal of help by a woman by the name of Henrietta Lacks. Henrietta Lacks had cervical cancer caused by that virus, and eventually her cells, grown by this guy George Gee, were able to develop a vaccine that has been a smashing success. By the way, the Gardasil vaccine has exceeded expectations very, very much. Then comes the genetically modified vaccine, and I'll show this one here is that's my paper that was contributed by, you'll notice, Fred Robbins down in the corner there. It says contributed by Fred Robbins from Case Western Reserve back in 1996. And that is where you take a vaccine, a live vaccine. I took an attenuated vaccine and then I modified it to put a suicide gene in. And this is the suicide vaccine for AIDS. And that brings us to now the molecular vaccine. And the molecular vaccine from Pfizer, the molecular vaccine from Moderna is a vaccine that is a very, very unusual kind of a vaccine. First of all, what we do is we take the spike protein, we take the message that is designed to make that protein, and that protein only, not the full virus, just one protein, and we coat it with fat, lipid particles, phospholipids. So we coat it in a fatty environment, and that's it. So it's really very, very, very kind of simplistic in the way that we put it together. And then because it's RNA, the RNA can eventually go away and disappear, and that makes it very safe. That's the great part about it. Unfortunately, also because it's RNA, it needs a great deal of refrigeration. You heard that liquid nitrogen tank go off here earlier today. That's minus 153 degrees centigrade. That's the kind of temperatures that you need to refrigerate this vaccine to make sure that it doesn't degrade and is still useful. So you inject that into the person. Those little particles absorb into cells. They start producing the protein, the one protein and the one protein only, and then those proteins get to the surface of the cell, and then you make an immune response to it, and that immune response is working. That's the really good news of this. The Pfizer vaccine is complete. The study is complete, and like I said, the Moderna vaccine will be complete within the couple of days. Both of them are going to go to FDA approval. And then comes the long part of waiting to get it to the marketplace, to get it into places where people can use it. I just want to remind you all that we are ready to, at least here at Lorain Community College, we are ready to store virus because we have liquid nitrogen. We also have minus 80-degree freezers available. I just want to tell everybody, if this is the thing that is going to get you through this dark moment, we are going to get through this. We are going to get through this, and I'm very optimistic. Do we go out and celebrate right now? Hell no. Right now we have to be very, very cautious. We have to protect ourselves so that we can make it to that period of time where we actually get this vaccine developed and get it into the marketplace. I had a student just this morning ask me a question. And one of my teaching assistants, and he asked me this question this morning. He says, "How come it took so long to get this vaccine?" To which I returned and said to him, "I have a different question for you. How did we do it so fast?" Because the fact of the matter is this is very fast. We have come up with a vaccine in I'll use the expression warp speed. We have not ever developed a vaccine this fast and had it work out so well from scratch. Every year we get a new flu vaccine, but those flu vaccines are basically just taking a few changes, here and there, and then developing a new one. The great thing about an RNA vaccine, let me go back to that picture. If you go back a couple of slides here, you can see that that vaccine here from that Pfizer, and the same goes for Moderna, is infinitely adaptable. You could choose a different RNA to put in there. And if you put a different RNA in there, you get a different kind of a vaccine. So if, let's say, this virus doesn't mutate very fast, but what if it did? Well, we could cover that. We could cover that in pretty short order. So that is all I have for you today. And I'll remind you all to persist like a lentivirus. I'll remind you all that be good to each other, and how you're going to be good to each other right now at this moment is wear a mask. That is the thing that you want to do. Be good to each other, and there is hope. And have a great Thanksgiving, even though if it's small. Just know this: it will be much bigger next year. Thank you.